Hello, welcome, and thank you for joining this webinar on ICD-10 Transition Lifecycle. Today's webinar, we will be focusing on how successfully you can manage the entire ICD-10 transition lifecycle. My name is Kash, and I'm working as a Meaningful Use Coach here in MTBC. With me, I have Ubaid. He is working as a business analyst in MTBC. He will be telling us more about ICD-10 during this webinar. Before we get started, let me tell you about this webinar. All attendees are joined in listen-only mode, which means that to ask a question or to make a comment, please type it in the questions option of the webinar panel. At the end of this webinar, we will have a questions and answer session, and we will try to answer as many questions as we can. But if you get short of time, and if you need to confirm some information, you will be reached via email. Let me also tell you a bit about MTBC. MTBC was established in 1999 and is currently serving 35 unique specialties in 39 states across the country. MTBC now has more than 1,000 employees, and we are running 24/7 operations. We're ranked among the Deloitte Tech Fast 500, and we are an Inc. 500 5000 company. We are also Microsoft Certified Gold Partner, and we provide ONC certified EHR, that's the electronic health record, and SureScript certified solutions. In today's webinar, we will be talking about some definitions about ICD-10, the awareness trainings, why do we actually need a new coding system. We will also talk about the benefits and advantages of new codes, the quality issues that are resolved when we will be implementing ICD-10, understanding the difference between ICD-9 and ICD-10, about the coding documentation changes and impacts, the medical necessity and reimbursements, the impact of ICD-10 on billing, and finally we will also be telling you the resources and trainings that you can browse around to get more about ICD-10. So let's get started with the webinar, and first thing that we will talk about to give you an overview about ICDs. International Classification of Diseases, 9th edition clinical modification, that is also known as ICD-10-CM, is a diagnosis and medical procedure code system developed in the United States and was implemented in 1979. It has 3 volumes. Volumes 1 and 2 deals with diagnosis codes that are used by almost all the providers, and Volume 3 deals with procedure codes that is used by hospitals for inpatient reporting. When we talk about ICD-10, ICD-10 is the 10th revision of International Classification of Diseases. It is a medical classification listed by World Health Organization that provides codes to classify diseases, signs and symptoms, abnormal findings, and external causes of injury or diseases. And in this system, every health condition can be assigned a unique category and is given a code. Now, the deadline for the United States to begin using clinical modification ICD-10-CM for diagnosis coding and procedure coding system ICD-10 for inpatient hospital procedure coding is October 1st, 2014. On your screens, you can see the timeline. Like it was mentioned that the deadline is going to be October 1st, 2014. So it is important for all the providers to start understanding ICD-10 because you won't have much time left to get to know about ICD-10. In terms of ICD-10 awareness training needed for a new coding system, we will talk about ICD-9 first. ICD-9 basically does not provide the necessary details for patients' medical conditions or the procedures and services performed on hospitalized patients. ICD-9 is 30 years old, has outdated terminology, uses outdated codes that actually produce inaccurate and limited data, and is inconsistent with current medical practice. It also cannot accurately describe the diagnosis and inpatient procedures of care delivered in the 21st century, and also it is running out of room for the addition of new codes. Now, when we talk about the change, why there is a requirement for the change, like it was said that ICD-9 is over 30 years old. And during those 30 years, there are a lot of advances in medical knowledge and practices that has really have overstepped the usefulness of the classification. Also, the ICD-9, the structure is limiting the number of codes that can be added, means that it is running out of room, and it also does not have enough detail for computerized analysis. Now, in terms about the implementation of ICD-10, first of all, ICD-10 consists of two parts. That is ICD-10 clinical modification for diagnosing coding, and second one is ICD-10 procedure coding system for inpatient procedure coding. So ICD-10-CM will be used by all providers in all healthcare settings, and ICD-10 procedure coding system will be used only for hospital claims for inpatient hospital procedures. Now, once again, it's going to be the October 1st, 2014 when ICD-10 will be completely implemented. Also, with the implementation of ICD-10, the current procedure terminology, CPT, the Healthcare Common Procedure Coding System, that is also HCPCS, they're not going to be changed. They both will continue to be used for physicians and ambulatory services, including physicians' visits to inpatients. So CPT and HCPCS, with the implementation of ICD-10, won't be changed. Now I will ask Ubaid to tell us about the benefits and advantages of ICD-10. Yes, Ubaid?
Thank you, Kashif. Hi, everyone. I'll take you through some of the benefits and advantages of ICD-10 medical coding framework. ICD-10 allows for increased specificity due to increased number of disease categories and codes, which will result in greater degree of details in the claim form with regard to the cause, stage, and intensity of illness. There will be higher level of accuracy in diagnostic and procedure coding, better and improved mortality codes corresponding to various causes of death, and better and improved injury codes corresponding to various causes of injury. Moreover, with ICD-10 framework, less number of codes is required to fully describe a medical condition. It uses a combination of diagnosis symptoms to describe a medical condition. Furthermore, ICD-10 framework is expected to enhance upon public health reporting and reimbursements and help with performance measures and medical error reductions. Moving on to the next slide, some of the quality issues that previously existed have now been resolved with the new coding framework. I'll quote a few examples here to elaborate on this. For example, ICD-9 clinical modification coding does not allow for laterality. So in a scenario where a patient has a fracture of left wrist followed by a fracture of right wrist a month later, there would be no way to differentiate between these two under the old coding framework of ICD-9. ICD-10, however, allows for a differentiation between the two causes of fracture. Further, ICD-10 also has specific codes corresponding to the stage of patient encounter with doctor, whether this encounter is initial or subsequent. Moving on to the next slide, another quality issue that ICD-10 attempts to overcome is that the medical coding is now structured in a more systematic, user-friendly manner and no longer follows an unpredictable, erratic format that once existed with ICD-9. So, for example, the code for combination defibrillator pacemaker device is not found in the cardiovascular chapter of ICD-9 with the other defibrillator and pacemaker devices. ICD-10 procedure coding system provides distinct codes for all these types of devices in a logical order. So, moving on to slide on the comparison between some of the fundamental components of ICD-9-CM with the features of ICD-10-CMs. ICD-9 clinical modification consists of approximately 14,000 diagnosis codes, and each of these codes have character range between 3 to 5 numeric characters, and whereas ICD-10 have diagnosis codes that range up to 69,000, and they are alphanumeric with between 37 characters. ICD-9 clinical modification codes lack details, literality, and difficult to analyze data because of lack of specificity. ICD-10, on the other hand, helps to improve on all these attributes of medical coding. Moving on to the next slide. Diagnosis codes will follow a different format under ICD-10-CM mechanism. Consider the case of fracture of unspecified part of right clavicle initial encounter for closed fracture. The corresponding code under ICD-9-CM will be 3 to 5 numerical digits and look something like 123.45. However, the corresponding code for the above-mentioned illness under ICD-10-CM will be 37 alphanumeric characters and looks something like S42.001A. The next slide highlights some of the major changes that ICD-10 has brought about. I'll list them one by one. The total number of diagnoses and procedure codes available add up to 155,000. ICD-10 allows for trimesters for obstetrics. ICD-10 also harmonizes mental health codes with American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. It harmonizes with ICD-10-02 for cancer registry. It expands injury codes in which ICD-10-CM groups injuries by sites of the injury. Furthermore, it also incorporates V and E codes into the main classification in ICD-10-CM. On the next slide, we'll continue with the changes brought up with ICD-10. These include that ICD-10 clinical modification is alphanumeric and includes all letters except U. ICD-10 clinical modification has almost twice as many categories as ICD-9-CM. The number of chapters has expanded from 19 to 21, and with the new chapters include eye, admixture, and ear. Each of these have their own chapters. Medical conditions have also been regrouped in ICD-10. The next slide. Moving on to the next slide, where we discuss the format and pattern of ICD-10-CM codes. ICD-10-CM codes are split into two different parts. Index, which is an alphabetical list of terms and codes, and tabular list, which is a sequential alphanumeric list of codes divided into chapters based on body system or conditions. The first character is always alpha. There's always an alphabet. The characters between 3 and 7 can be alphabetical or numerical. Decimal is placed after the first 3 characters of the code. The letter X is used as a dummy 5th character placeholder. Example P36.0x1A, initial encounter for accidental poisoning by penicillin. The next slide, we will talk a little bit about ICD-10 procedure coding system, which will replace the current 3rd volume of ICD-9. These procedures currently have codes with 3 to 5 numeric characters and exclude common procedures that are not unique to inpatient settings, such as lab tests and awareness programs. Current procedure terminology, on the other hand, is used to code for procedures relating to outpatient settings and will not be affected by ICD-10 implementation. And the next slide, which sums up the core changes brought up by the new coding framework. We have a unique code for all substantially different procedures. The new coding structure is very much adaptable and flexible to future changes in procedures. Definitions are defined and standardized to make the system more user-friendly. Now I'll pass it back to Kashif, who will talk a little bit about the documentation. Thanks very much.
Thank you, Ubaid. Now, in terms of documentation and coding impacts by the implementation of ICD-10, first of all, the ICD-10 clinical modifications guidelines for coding and reporting can be found in the front of the ICD-10 clinical modifications coding book. By the end of this webinar, we will also be providing you some links where you can actually browse that book and can get more details about the codings. Like an example, for diabetes documentation and coding, we'll need to specify type 1 or type 2. And also the cause of diabetes, such as drug or chemicals, any underlying conditions, or other specified diabetes. Another example, the diabetes code capture will require documentation of the body system complications that will be related to diabetes, such as kidney or neurological complications. Now, the physicians will have to embed large number of new concepts into documentation, providers need to focus on neutrality, like left or right part, body parts, for example, if that's bone in the hand. When we talk about these stages of diseases, we talk about the severity of certain disease in terms of injury, how this injury was caused, for example, hit by a baseball. We also will be required to go for the episode of care, that is initial visit or is that a follow-up visit. So these are the parts, or these are the details that the provider needs to focus and will be required to provide the documentation for that. Currently in ICD-9, there's no such requirement for the documentation of these codes. But when we talk about ICD-10, each and every component of the code needs to be supplemented with relevant documentation. In terms of medical necessity, so the ICD-10 links the diagnosis submitted with the procedures or services performed on the patient, and this will also improve the justification of medical necessity. In terms for the payments of claims, the third-party payers will expect providers to meet the new medical necessity criteria for the payment of claims. Now, the ICD-10 impact on billing, due to the potential backlogs with coding, it can impact timely filing for billing claims. Certain queries from physicians can also hold up the claims. So it is important that all providers in facilities must test their system with third-party payers to ensure that the parties can both send and receive, like there won't be any technical difficulties for the ICD-10 transitions and so on. There will be increased documentations. This will also delay in the payments, and overall there are chances that the collections will be decreased till ICD-10 is fully understood and is fully implemented. Furthermore, in billing impacts, there's this general equivalency mapping system, also known as GEMS. This is developed by CMS to map ICD-9 and ICD-10 codes. Now, on GEMS, the drawback is that one code of ICD-9 has many links with ICD-10 codes. In other way, there will be difficulties in translating the codes in ICD-10. Like said that the deadline would be October 1st, 2014, so all claims will move from ICD-9 to ICD-10, and each health plan has to directly match ICD-9 to ICD-10 codes and match the rate of reimbursements as well. And also the health plans need to map against medical policy, claims edits, and reimbursements methods to understand their impacts on business processes and system. Like we mentioned, that we will be also showing you certain resources and references, and the annual updates of each system will be posted on ICD website. The website is cms.gov/ICD-10. You can always browse on this website to get more resources and references about ICD-10. There will also be the journal equivalence mapping assistance in covering the data from ICD-9 to ICD-10. So in terms of GEMS, you can always log on to cms.gov to get to know more about how the coding linkage will be done and so on. Now, when we talk about MTBC's steps in order to have a successful transition of ICD-10, we'll be conducting intense and continuous assessments of provider and partner readiness through outreach and engagement programs such as this webinar, which shall serve a platform for providers or vendors' interactions. And we will also be providing a beta testing strategy. That beta testing strategy involves the following steps. Number one, who wants to test? So in answer to that, whoever would like to stay abreast on all major developments and be a part of successful implementation on ICD-10 systems can perform the test. When will they be ready for the test? Well, this is at the discretion of the provider, but we recommend the sooner the better. Now, what do we test? MTBC will basically be testing ICD-10 test claims as soon as you receive instructions from MDON. Now, MDON is our major clearinghouse, and we will be just going through regarding the claim testing as soon as we get more instructions from MDON. Then is, how do we test? Now, MTBC will be testing in coordination with our clearinghouse, and further details relevant to this will be released in the upcoming webinars, because we will have a series of next webinars coming up that will be providing more information about ICD-10 transitions. If we talk about MTBC, ICD-10 tools and resources, we have established a provider resource center that will be providing relevant information about ICD-10 and different resources. At any stage, if you would like to send an email about any question or suggestions, you can always send it to ICD-10@mtbc.com. Once again, that is ICD-10@mtbc.com. Or you can also log on to the website, that is mtbc.com. It will have a lot of information about ICD-10 and certain links. And we're also planning to have the scenario-based challenges in order to make the provider understand better about the ICD-10 and its implementation. So in today's webinar, we actually have covered about the ICDs their comparison, the awareness training, what are the different benefits and advantages, decoding and documentation changes and their impacts, medical necessity, and we also talked about the delay in the billing and the reimbursements due to the ICD-10 implementations. Now, for further tools and resources, you can always log on to cms.gov, or you can use ready.org, and also another website would be ICD-10watch.com. You can always browse on these websites to get more information about ICD-10 tools and resources. Now, at this stage, we will be simply requesting if you have any comments or any questions, you just have to use your webinar panel. Just type in a question and send it over to us. You can always contact us at ICD-10@mtbc.com. A copy of webinar will be available on our website in about 2 business days, so you can always go through this webinar in order to know more about ICD-10 transitions. And or if you wish, you can also reach us at 732-873-5133, extension 102. Now, we will take a short pause over here because we just have to retrieve the questions. If someone needs to ask any questions, please feel free to type it in the questions panel and we will answer it. So we'll just take a small pause and we will be back with the questions and answers. Thank you. All right, thank you for holding on. Now, starting over with the first question, it was asked that would there be any possibilities to print on these slides or these presentations. Like I said, that it will be available on our website in about 2 business days. You can go to mtbc.com/webinars.aspx, and you will get a copy of this webinar available on our website. We're getting more questions, and so another question is that if the provider transitions, if the transition is taken early to ICD-10, will MTBC be able to process, any claims of the provider? Well, the answer is no. MTBC will not be able to process claims using ICD-10 until the compliance date, that is October 1st, 2014. However, providers should expect ICD-10 testing to take place starting 3rd quarter of this year. That was the beta testing, so you can always participate in that in order to get to know more about ICD-10. Another question is that the ambulatory surgery center will use ICD-10 for diagnosis and current CPD codes for procedure codes. The answer is yes, that's correct. And another question is, will MTBC be updating the diagnosis lists in the office-based EMR? Yes, absolutely correct. As soon as we get more information about ICD-10 or the transitions, we will definitely be updating all the systems as per the requirements.
Well, we have this one question here that what happens if I do not switch to ICD-10? Well, the claims for all services in hospitals, inpatient procedures performed on or after the compliance deadline must use ICD-10 diagnosis and inpatient procedure codes. Claims that do not use ICD-10 diagnosis and inpatient procedure codes cannot be processed. It is important to note that claims for services and inpatient procedures provided before the compliance date, however, must use the ICD-9 codes. So any codes, so any procedure that is initiated after the compliance date, that must follow the ICD-10 coding framework, and any procedure or diagnosis that has been established or initiated before the compliance date, that should adhere to the ICD-9 coding standards. I hope that answers the question.
Okay, and another question is asked that what will be the first step to start ICD-10 into practice. So like we said, that as soon as we get more instructions, we will be coming up with the beta testing, and this testing will basically be explaining how the claims will be submitting using ICD-10 and so on. So you just have to wait till the 3rd quarter of this year, and as soon as we come up with that beta testing, we will be notifying our providers how they can basically start implementing the ICD-10. And another question is that about the errors message in terms of CPD and ICD-10 codes. So yes, currently in our systems, specifically in the EHR, whenever there is a coding error going on in terms of CPD or ICD, that system automatically tells. So yes, same format will be applied in ICD-10 in case if there is any error in selecting the CPDs or ICD-10 codes, the system will automatically notify about it.
Well, we have this one question here that why should I prepare now for the ICD-10 transition? Well, the transition to ICD-10 is a major undertaking for providers, payers, and vendors. It will drive business and systems changes throughout the healthcare industry, from large national health plans to small provider offices, laboratories, medical testing centers, hospitals, and more. You will need to devote staff time and financial resources to transition activities. The transition will go much more smoothly for organizations that plan ahead and prepare now, so we recommend the sooner the better in order to have a successful and smooth transition. And we'll see if you have any more questions.
Yes, we do have one more question, and that is that the state Medicaid programs need to transition to ICD-10. Yes, like everyone else covered by HIPAA, state Medicaid programs must comply with ICD-10 as well. Okay, we do have another question, and that is what type of training will providers and staff need for the ICD-10 transition? Well, it is recommended that training should begin no more than 6 months before the compliance deadline. And ICD-10 resources and training materials will be available through CMS, any other professional associations and societies, and also MTBC will be posting different links and information on our website as well. So as soon as more information is received, we will be coming up with a solution for that. And also, once again, the beta testing will basically be an important aspect in the transition of ICD-10. So that will basically be clearing a lot of confusions and problems among all the providers, like how this transition is taking place and what are the changes and so on. So like the third quarter of 2013, we just have to wait until we come up with more instructions and so on. We are not getting any other questions, and once again on your screens you can see that apart from this webinar, if you have any questions, you can always send in your questions to ICD-10@mtbc.com. A copy of this webinar will be available on our website, mtbc.com/webinars.aspx. You can always go through this webinar, and there are also other webinars available in terms of ICD-10 and so on. And in the future, we will also be coming up with more webinars to provide more information about ICD-10 transitions.
Right. Well, it seems that we're running short of time right now. So I think this would culminate today's session. And well, thank you very much for your participation. MTBC is fully committed to making ICD-10 transition hassle-free and smooth for all our clients. We will be fully ready to process ICD-10 claims by October 1st, 2014. And as part of our efforts in raising awareness about ICD-10, we will be conducting more webinars in future, and we look forward to your participation and interest in our future seminars. And a copy of this seminar would be available on our website. So thank you very much for your interest and participation, and good luck with the ICD-10 transition.
All right, once again, everyone, thank you very much for joining this webinar, and thank you all for that. Have a great day. Goodbye.